Hi, my name is Nora and I work for the Daly City Youth Health Center. Today I'm going to be talking about the options a person has if they discover they are pregnant and do a little brainstorming about how someone might decide. The first option I'm going to talk about is abortion, which is ending a pregnancy by removal of an embryo or fetus from the uterus. There are two types of abortion. There's the medication type, also known as the abortion pill. This must be done within the first 10 weeks of pregnancy. The patient is given two medications. The first causes the body to stop making the endometrium, and the second causes the pregnancy to leave the uterus, kind of like when tissue leaves the uterus during a period. The process can take a few days. The second type is called the aspiration type or the suction abortion. Most are done within the first 16 weeks of the pregnancy, but can be done up to 24 weeks. This procedure is performed in a clinic or doctor's office using a vacuum aspirator to empty the uterus with gentle suction. Later term abortions are allowed in rare cases, like if it's a threat to the mother's life, there's a severe birth defect, or a late term miscarriage, and your doctor will follow up after either type of abortion. So abortions in California. In California, teens do not need parental notification or permission to obtain an abortion. And both types of abortion can be paid for through Medi-Cal or emergency Medi-Cal here in California. The Daly City Youth Health Center does not perform abortions, but we have counselors who can refer a patient to local clinics that do provide abortions. There is a misconception that only young people who made a mistake need abortions, but there are many reasons an abortion is needed, including reasons that are out of our control. For example, an accident, like say if the condom broke, or force, in the case that a sexual assault leads to a pregnancy. Birth defect, limited or no access to birth control, if the person does not want to be a parent or is not ready to be a parent. Maybe they can't afford to raise a child. Having a child costs a lot of money over the course of 18 years. Perhaps they're not healthy enough or do not want to go through a full pregnancy or childbirth. This can be especially hard if the person is a regular alcohol or drug user. Maybe there's not a safe environment for the baby, like an abusive home or a war. And even if it was an unplanned pregnancy, we all have bodily autonomy, the right to make decisions about our own bodies, and pregnancy should not be used as a punishment. So everyone has different values around abortion. Some people believe abortions are killing a baby. Medically speaking, it is not a baby yet until it has been born. But regardless of our different values around abortion, we have to be aware of the impact of this kind of language. Why? Well, it promotes a lot of shame for those who need or want an abortion. Ultimately, it's up to the pregnant person to make the best decision for them. But if they are pressured by other people's opinions, they may not make the best decision for themselves. Are abortions safe? People often wonder this. And yes, they are very safe. 99.95% of abortion patients do not experience serious complications. Legal abortions do not affect the ability to have healthy pregnancies in the future. For example, infertility, miscarriages, birth defects. And abortions are made safer by access. Consider rural places or states without clinics, or states that don't cover the cost. If legal abortions are inaccessible, it doesn't stop people from needing abortions. It stops them from getting safe abortions. Consider how desperate a person is to get an illegal abortion with improper and unsterile tools. Illegal abortions are extremely dangerous and can lead to serious infections, infertility, and even death. Limiting access to legal abortions disproportionately affects low-income people because they have fewer resources and options. This is a friendly reminder. Please fill out the question about abortion on your handout. And feel free to pause the video to give yourself time to write.